Member for Sanderson.
Mr. Deputy Speaker, thank you for this opportunity to speak on the matter of public importance raised today. That the NT government ensures its investment in healthcare meets current and projected future needs of all Territorians. This is indeed a critical matter, as healthcare is fundamental to the well-being of our community. As a member for Sanderson and part of the current CLP government, I wholeheartedly agree with the importance of ensuring quality and future-proof healthcare investments. However, Mr. Deputy Speaker, it is important to critically assess how effectively previous investments have translated into better outcomes for Territorians. We must look closely at the past to clearly understand the challenges and define our path forward. The previous Labour government from 2016 to August 2024, while significantly increasing healthcare staffing levels, failed to match this growth with a corresponding enhancement in service quality or outcomes. The budget documents clearly reflect this disparity. Full-time equivalent numbers increased, yet quality indicators and patient experiences deteriorated. The healthcare sector is home to many dedicated professionals who are committed to delivering the highest standard of care to the people of the Northern Territory. However, the reckless and misguided expenditure of the past 8 years under Labour is only now drawing alarm for the opposition. Let's consider the facts. In reviewing the health budget papers from 2016-17 to the most recent 2024-25 agency budget statement, we observe significant growth in healthcare expenditure. Yet, despite such increased investment, the system under Labour continued to suffer, which in turn can lead to degradation in service quality. Firstly, Mr. Deputy Speaker, hospital wait times have escalated dramatically. Patients across the Northern Territory were waiting longer for critical procedures and treatments, even though the population numbers have remained relatively stable. For example, waiting times for elective surgeries and emergency department treatments have seen substantial increases year on year, putting undue stress on patients and their families. Additionally, Mr. Deputy Speaker, I facilitated a meeting yesterday between representatives from the Ministerial Advisory Committee for the Seniors and Minister Edgington. Their number one concern was the critical shortage of aged care beds, which has directly led to numerous elderly Territorians occupying hospital beds instead. This situation starkly highlights the former government's lack of action and foresight, causing many senior Territorians who spend their lives working hard and contributing taxes to spend their final days in hospital beds rather than in the dignity and comfort of appropriate aged care facilities. The previous Labour government members might attempt to justify these deteriorations, citing COVID-19 as a contributing factor. However, it is important to highlight that the impact of COVID-19 in the Northern Territory was negligible compared to other regions of Australia. It cannot explain the consistent degradation we witnessed over multiple years. Moreover, Mr. Deputy Speaker, the previous Labour government's era was marked by a significant expansion of administrative overheads. The growth in healthcare FTEs predominantly occurred in the administrative roles, rather than frontline health professionals who directly improve patient outcomes. Increased bureaucracy has not translated into better care. Instead, it created layers of inefficiency, diluting the impact of every healthcare dollar spent. When considering the evidence of patient feedback, staffing distribution, and quality performance metrics detailed in successive budget papers, despite higher spending, key performance indicators such as patient satisfaction and timely care delivery have worsened. The previous Labour government allowed inefficiencies to grow unchecked, disregarding practical outcomes for Territorians. I heard the member for Daly speak highly of the previous government's support for staff. But let's be honest, the reality tells a very different story. One of the most damaging decisions made by the former Gunner government was the introduction of a public sector pay freeze. They called it responsible budgeting, but in truth, it was a blow to the very heart of our health system. The people most affected by this was our hardworking social workers, psychologists, occupational therapists, pharmacists, speech pathologists, dietitians, Aboriginal license officers, hospital support workers, and frontline admin staff members who form the backbone of our hospitals and health services. These are the people who show up every single day, often under immense pressure, to care for our community, and instead of being rewarded or recognized, they were told to do more with less. This isn't just about wages. It's about the respect, retention, and recognition. And the consequences have been devastating. The pay freeze led to staff morale plummeting and contributed significantly to the workforce shortages and burnout we are now grappling with across the Northern Territory. During the previous Labor government, the crime was skyrocketing. Alcohol-related presentations were on the rise, and our hospital and clinic staff were bearing the brunt of it all. Health workers who dedicate their lives to caring for others were becoming the punching bags of antisocial and intoxicated individuals under the influence of alcohol and other drugs. The level of abuse endured by our frontline health staff during this time was nothing short of appalling. Verbal threats, physical assaults, and constant fear became part of their daily working environment. These are not just statistics. These are real people doing vital work who were left exposed and unsupported. The government of the day failed to protect those who were protecting us. Their inaction allowed this culture of violence and disrespect to take root in our health system. And the damage it's caused to staff well-being, to morale, and to retention has been immense. So when we hear praise for the previous government's support for staff, we need to call it what it is, empty rhetoric. They said one thing but did the opposite, and our health system is still paying the price. Our government now faces the task of recalibrating this imbalance. Minister Jinton's priority is clear. Investment in healthcare must be strategic, accountable, and outcome-focused. The CLP government will rigorously ensure each dollar allocated to healthcare achieves measurable improvement in health outcomes for Territorians. Mr. Deputy Speaker, while the Labour opposition raises this matter of public importance, it is their record that demands scrutiny. Territorians deserve better than higher costs for deteriorating services. Our CLP government is committed to restoring efficiency, quality, and accountability in healthcare investment to meet both current and future needs effectively and sustainably. Thank you, Mr. Deputy Speaker.
Thank you, Member for Simpson.